Hi, this is Dr. Karen Becker, and we're going to discuss heart disease today. Heart disease is heartbreaking for many owners because until your pet exhibits symptoms, most of the time it's a silent killer. So by the time your pet becomes lethargic, coughs, wheezes, has exercise intolerance, sounds like it's croupier, like there's fluid in the lungs, by the time dogs and cats both exhibit these symptoms, it can be simply too late. Even more heartbreaking is pets can sound fine at the veterinarian. Veterinarians can't hear the size of the heart. So veterinarians can listen to your pet's heart with a stethoscope and not hear a murmur, and yet there can be gross heart enlargement and in fact heart disease, significant heart disease going on before your pet shows clinical symptoms, which is heartbreaking, of course. Both dogs and cats are susceptible to heart disease. There are two types of heart disease that affects both dogs and cats. Number one is heart muscular disease, and then there's valvular disease. And dogs and cats can have both. The heart muscle can become enlarged in both dogs and cats. This condition is called cardiomyopathy. There are some breeds that are predisposed to cardiomyopathy, like Newfoundlands, Great Danes, and Dobermans. There are some dietary deficiencies that can cause heart muscle enlargement. The amino acids taurine and carnitine are both critical for normal heart development and maintenance. And if dog and cat diets are deficient in these two amino acids, heart muscle enlargement can occur secondary to dietary deficiency. Valve health also can contribute to congestive heart failure and heart disease. Leaky valves or heart murmurs can be genetically predisposed, like the Cavalier King Charles Spaniel. Or you can also have leaky valves secondary to age or sometimes metabolic conditions like hyperthyroidism in cats. Heart murmurs are graded on a scale from 1 being the most mild to 6 being the worst murmur. And what a leaky valve does is it makes the heart work harder. So eventually the heart muscle, anytime you work a muscle, it gets bigger. And as the heart becomes big, it becomes inefficient. So valve disease predisposes dogs and cats both to congestive heart failure. Traditionally, heart disease is diagnosed either through hearing a murmur, which is the veterinarian listens with the stethoscope, on physical examination, and X-rays or EKG or cardiac ultrasound are ways that if we believe heart murmur or heart disease is occurring, we can verify our findings through some expensive diagnostic tests. Probably the biggest frustration is most people are not interested, nor do I recommend you drop $500 to $700 in some of these tests if you're just interested in being proactive. And yet if you've lost a dog or cat to heart disease, you realize how neurotic you can make yourself in trying to do everything you can to prevent this from occurring because you had the heartache of having it occur so quietly that you weren't aware that it was happening. So it's hard to be proactive until recently when it comes to heart disease because you almost have to wait until you're in it before you can identify it. But that has changed. In this last year, veterinary medicine has finally acquired a blood test that can identify early predisposed dogs and cats to heart disease and heart failure. This test is called a pro-BNP test, and the BNP stands for B-type natriuretic peptide. And the pro-BNP test is a blood test that measures how much of this peptide hormone that's released from the heart is in circulation. This hormone that's released from the heart muscle only releases itself when the heart is stretched beyond normal capacity. So very early in a dog or cat's heart pathology, small amounts of this hormone will be released into the bloodstream. And as heart pathology continues very early in the game, this blood value will continue to rise. So now, instead of worrying that your dog or cat has an issue, you can ask your veterinarian if your dog or cat has a mom or dad that has died of heart disease, if you want to be proactive and make sure that your dog or cat does not have early heart disease going on. If you have a cat that you want to differentiate respiratory disease, let's say feline asthma, from an underlying heart condition, this is an excellent test to ask for with your veterinarian. And it's easy, simple, it's done with a blood test. The turnaround time is very short and it can provide a wealth of information. The other great thing about this test is it can, because it's quantitative, it'll give you a number, you're able to repeat the test and make sure that you are meeting your cat and dog's cardiovascular needs as they go through life. So excellent new proactive blood test available to be able to identify very early cardiac changes that can actually prevent your pet from going into heart failure. Wonderful. The second most common thing I can tell you, common sense thing I can tell you to do when it comes to preventing cardiac disease from occurring in your dogs and cats is to make sure that you're meeting your dog and cat's CoQ10 requirement. CoQ10 is a naturally produced coenzyme that dogs and cats make typically when they're younger in abundance, and then as dogs and cats age, their ability to produce adequate amounts of CoQ10 diminishes. Coenzyme Q10 can be supplemented or supplied in your pet's diet. And I do recommend that if you have a dog or cat that is predisposed to cardiovascular disease, if you're interested in preventing it, if there's a genetic link that if you have a dog or cat that is a high-risk breed, you supplying extra CoQ10 is buying good, healthy heart insurance that your pet has an abundant supply to be able to effectively deal with supplying adequate CoQ10 for healthy heart muscle. CoQ10 comes in two forms supplementally: ubiquinone and ubiquinol. Ubiquinol is the reduced form of CoQ10, and it's the form that I recommend you supply to dogs and cats if you're interested in nurturing their heart muscle. If you're interested in supplying extra CoQ10 or ubiquinol to your dogs and cats, a nice heart-healthy maintenance dose would be 50 milligrams for cats and small dogs once a day, 100 milligrams for medium-sized dogs, and for giant dogs, 100 milligrams twice a day.